Thank you for checking out Dr. Christine Greves' website. I'm sitting down with her today to talk about all of your most important questions about the female body. So let's dive right in. Dr. Greves, what can pregnant women expect when they go into the hospital and they're in labor? Should they be scared? Should they be nervous? What kind of things can they do to prepare themselves for that time?
Once you get to the labor and delivery unit, you'll meet your nurse. You will have monitors most likely placed on your abdomen. One monitor assesses the baby's heart tones. That way we can watch the baby throughout this process to see if it tolerates the contractions, to see if it tolerates this process of labor and delivery. And then the other one is contractions. We monitor how often your contractions are occurring. And then we see where the baby's heart tones line up with the contractions. So we're monitoring you that way. Then we're checking your vital signs, making sure your blood pressure is okay, making sure that everything is going okay with your cervix as well. We're performing regular cervical exams on you. The reason for that is because the whole definition of labor is regular uterine contractions with cervical change. We want to make sure if you're there for labor and delivery, you will have your baby. So we're going to be checking your cervix to see if it's changing. Is it changing on its own or not? If it's not changing, then we start to wonder, do we need to provide help for you? And some people may have heard of the word oxytocin or pitocin and may have been scared. Well, we monitor the baby. We're monitoring your contractions, and we do not want anything but a good, safe experience for you and your baby. So just keep in mind that sometimes people need to have a little assistance because the uterus, as strong of a muscle as it is, may need to have a little help. Like our muscles, after we go for a run or if we're running a marathon, we may need to have some sugar during that. The same holds true for our muscles. We may need to have a little assistance with our uterine muscle by getting some oxytocin, okay, or pitocin, and we monitor throughout, making sure everything's okay with your baby and making sure the baby can tolerate it. So we may need to give you that because the power has to be good. And then the next question is the passenger. What size is your baby? Is your baby large? Is it small? What about your pelvis? Can your pelvis accommodate the baby as well? So is the pelvis large enough? And we go through all of these questions. We assess you, assess your progress, and then we may need to give you some help, with the end result hopefully being when you are completely dilated. And then we'll allow that baby to come down through your birth canal and deliver your baby, and then put your baby up on your abdomen so you can have your nice skin-to-skin contact, and then the rest is just fantastic. Now, a lot can happen during that process though. A lot of unknowns. The baby's heart tones may go down. There may be other components. Maybe you're not progressing. Maybe the baby's not going to fit down your pelvis. If that happens, it doesn't mean you're a failure. It doesn't mean that you should be super sad. Our goal, keep in mind, is a healthy baby and a healthy mom. And sometimes that means that we may need to take your baby out through your abdomen by performing a C-section. And I know that's not what we want. We would love to have a nice, safe, healthy vaginal delivery for people. But if that's not part of your cards, then know that we are trained for that and we can do that to get a nice crying baby hopefully at the end and keep everyone safe. And if not, then we're there to hold your hand throughout that journey with all of the other things that can come up during the labor and delivery process that can make you a little nervous. But we're here for you and super excited for you.